it's now time to talk health. On the Max Morning Show, one of the sicknesses, I should say diseases, that some people have abused and have made money out of and have caused even thousands more to die and to worsen is fibroid. It's been exploited, And the wrong information that is out there is what we want to correct this morning on the Max Morning Show. And that is why we're privileged to have Dr. Owusu Fordjour, Medical Director of Ultimate Clinic. And he is here to help us set the record straight where fibroids are concerned. He likes to call it uterine fibroids. Now, apart from uterus, is there any other part that we can see fibroids? No. Anyway, all right, so uterine fibroids. Doctor, send me kind akwaba in the first place. Yeah, that's the password of kind. Send me kind yare bakwa and ne sebi unscrupulous hebafobi. Any doctors be I want here see agin kofosi kedi ebi afasade ehu awu ebi kran so yare na is serious fibroid ehun komo bubruja so hu nia no kore ne da enti na wabai we set the record straight yen nyina ate fibroid hu nsem pii but and they set the record straight cat a fibroid cry edien.
All right, so like we always do your day in Chakes here my for following us all this while. And you can uterine fibroids are just like you said, one all the uterus then it's limited to the uterus. You know, most often in this our setting, then we see a lot of things about it. You know, baby to say hemorrhoids, cocoa. We see so many things, and it's similar to fibroids. We see so many things that are not hitherto true, but people are still practicing them. You can fibroids. They are basically non-cancerous tumors. We have tumors in two ways. One is malignant, one is benign. You can say malignancy, then it means it's cancerous. You can say benign, then it means it's not cancerous. Tumor means a growth, and a baby be a baby. And say ba o.
Who can say hunia or baby? And say we no hunia e wa would you?
Yes, any cancerous. Ne tibia na ne bob ne AI it's a cancerous, but no, it doesn't multiply as fast, and it doesn't. Malignancy means that, say, I don't know if it's for instance, if I have tissues in my palm, I can find those tissues in my feet.
Okay.
Which means it has moved from its original location to another location. Okay. Uterine fibroids cases are not like that. They are confined to the uterus. And to make it easy simple, no, they are basically growths in the uterus that are non-cancerous.
They are non-cancerous.
Yes.
And so I would do any time ewo.
There are various types of fibroids. Okay. Medically, it stands from myoma and leiomyoma. And we are referring to fibroids. Yes.
Fibroid you want
Yes, you want depending on the location.
Okay, three more.
Offer I would and I say uterus now. Sending kind of basic anatomy and basic sciences like just your ovaries and your fallopian tube and your uterus and your cervix and vaginal and the vulva area. Yes, but usually, no, even when you take the uterus alone, womb na kasa no, you will I so offer maybe say mango and a pear.
Pear na ya na me pear.
Yeah, it's a pear-shaped
pear shape, yes.
Yes, so yes, we can comfortably use pear. Offer pear,
like the whole
fruit or vegetable.
And yes, a seed, you know.
No, and yes, seed. No.
Okay.
Yes. Obviously, I liken the womb to a pear. You know, once the outside layer, no, and you the edina womb, and your inner thin layer.
As I did as a seed, you know.
Seed,
but I thought that we seed to me cut.
It's me cut. Exactly.
Okay.
Yes. If you liken it to uterus now, you were inside the endometrium.
Okay.
And your mucosal lining within the endometrial space. Fibroid masses need to grow on the uterus.
Okay.
Sometimes we want to not baby sanso. I say, once you cry, baby tiana baby round. And your friend pedunculated fibroids. Not just say, it's your audience. And no usually comes outside.
Okay.
Yes, and I know your rare forms of uterine fibroids.
Okay.
And your dear, just after a horn, between a home and any aduane na yedi no in fact say nka pair fibroid meet me kwasha ha it any friend subserosal.
Okay.
I just say just beneath the layer. And no your friend subserosal. And also it happens, but it's not yet so common. But it is more common than the pedunculated one.
Okay.
And you the ba aduane na yedi ni mankasa and your friend intramural. Ti no dey share or muscles nim or awode no nam nim. And your friend intramural. I just say hona and they are very common.
They're very common.
That's the most common form of fibroids.
Me who say Alex for question, but answer na Alex baby sano. Is every woman susceptible to getting fibroids? Or baby a bit me enya fibroid?
Enyo baby a.
Enyo baby a.
Yes.
I didn't know kasa.
Maybe
because or baby a wa maybe me a would
yes, maybe me a would.
So but that could be very rare.
Yeah, that's rare.
Because or baby a big man so baby or baby any be it assume say
owo yeah.
And it me say me man say Martin we your man say 9 ewo awode a. Is it possible so omumu bi betumi enya bi?
Oh yes,
and now about what would you be to me be?
Yes, aside the kind say ebu ha no ni awode no. Ebu also not starting menstruation.
Okay.
Fibroids are usually in reproductive women.
Oh,
yes,
onset of puberty.
Yes.
Oba sabi we see ni mem.
We see ni mem obuninsa.
Obuninsa.
Yes.
Nti hono na fibroid no ebetumi a share.
Yes.
Okay, I wanted to ask say a DNA the baba me who kwesi wants to put something there.
I wanted to find out say I mean onset of puberty really brings that, and also friends saying family, is it inherited from your friend is saying my friends say family lineage and I say visa.
Yes, your risk factors.
Okay.
For every disease condition, your risk factors. Risk factor means that BBA say around you with chances are higher, not necessarily say a cause.
Okay.
But they push you into it if you don't take good care of yourself. Yes, into risk factors maybe if you will boost your it is likely so also be maybe.
Now, yenka omo ye friends and plus near the no I guess if one near the are they also prone to
yes, obesity and so obesity. Yes, a risk factor.
Yeah.
Yes, it's a risk factor.
And then with that one, how does that happen especially? Because we're dealing with a lot of women who are obese away counting near the how does that happen?
Okay, previously obesity was not considered seriously, but now it is listed as a disease. This is because once they be America say unsure be name and be appearance in case of obese. There are ways of going about it. Yes, okay. The person you have to measure the height to the weight.
Body density.
Yeah, body mass index.
Index.
Yes.
Okay, cool.
See, without checking the body mass index, until you can say you're obese. You understand? So when we checking the weight to the height ratio, not a bro so your classifications. We start from underweight, normal weight, overweight. From overweight, then you go to obesity. Okay. Then you go to morbid obesity. Then you know your scales for that. Yes. What happens is that when you're obese, that it means like we said, body mass index is higher, and it means you have more fat as well. Okay. And fat cells over the time have been known, say they misbehave. Especially if you deposit fat cells around your lower abdomen. They quickly change in their structure. And we assume, say, the fat cells could have, and also to me, precursors for production of certain hormones. And when you talk about uterine fibroids, one of the hormones I say it's me money. If the fibers are there, not say hormones need to do so, how money in tentem, progesterone and estrogen.
Okay.
And these ones can also be produced from these fat cells.
If they are high.
Yes. Yes.
All right. And doctor, I think we you need Dr. Owusu Fordjour of the Ultimate Clinic on your kwanche for penia or that Ultimate Clinic and on ye can be a woman a band of fibroid when we say ya te na ye hunu ni misinformation ebe to me ama and maybe afemu. I think we what na ho from your baby no one Max TV. If you say nenya obesua ha no ebe to me as some brabo. Now what can hereditary say obusuani bi wo bi what can say kesi dodo enso to me ba what other causes? Let's look at lifestyle, let's look at scientific causes and others.
Okay, causes there say they be in the next subsequent generations now we will have causes. But as it stands now, there are no known causes for fibroids.
But risk factors.
There are risk factors.
Okay, so let's consider the risk.
Yeah,
risk
so
factors.
bibinia, black women are usually stand a higher risk of.
Why?
Yeah, no, I can treat a man because
I had
before
someone very close to me, gone for operation for fibroids, and it was funny. We share nipa no ne the word. Now we are muy free when the case here and easy, so it's very very way. Until when you say we don't know the main cause now, it will take generations of scientific research and idea, then that means you're a problem.
Oh yes. And it makes it a money ding in that own causes now usually a symptomatic treatment. Even cause even cancers we don't know causes of.
Nobody knows what causes.
Even hypertension. 98% of them are causes. So we are trying.
Okay, so fat risk pattern, being obese could be, hereditary could be, and even being a black woman as well. Say we are bibinia, we are about to more. Now we are about so we shall say boon sa, and also so boon tantem one.
Ibu has early as 9 years.
No, I shall say boon,
and also now a risk factor, and also predisposed to uterine fibroids.
Okay.
And we also na menses in chantem. We have prolonged menopause, and also higher risk of.
So we can prolong menopause. Inka ideally, or bad drew and fear saying and I will say the menses nature. Not all shall say echo menopause.
It was usually between 50 to 55.
15 to 55. 50.
Yes.
To 55.
Yes, but now you have women as young as 35.
Going through menopause.
Yes.
Okay.
40. So you see, between 40 to 50, usually these women.
But yeah, busuemuno Emma and Trabrantem. Somebody close to 59 is still doing it. The Nipakra unyini pa wo ewo me busuemuno was 58.
Wow.
Hey.
Wow.
Pregnancy at 58.
Are you serious?
Yes, I'm serious.
Wow.
And so omu Trabrantem and it's quite active. So you are saying say busua etisa no.
Yes, like because at that time still it means progesterone, estrogen is still being produced in higher quantities in the body.
There are people in the north, and so soon Trabrantem, omu deep into their old age. Into I didn't know no fibroids in time anywhere. What? Because it's true. We call the northern side of the year omu bebre. Omu ntwa wo suntem. But fibroids in shed there anyhow. So could it be lifestyle of the people, the rich and famous, or our food and all of that? Because omu aduane omu die no up north no. Quite different from what we eat here. Into omu aduane omu die na den chiremu kakra.
Yes, it could be lifestyle. But one other thing I mean when say number one, fibroids may not give you signs and symptoms. Largely. Show signs and symptoms grandma to make her go to the hospital to check if there is one. And sometimes we call some environments via but they don't have the diagnostic tools to look for them.
Okay.
And once it's not giving her signs or symptoms, any idea will be to one more. Because fibroids could be very small and could be very large, like Alex can, to the extent. Some can be as large as melons.
Yes.
Very huge, Yes, and it could be lifestyle, it could be for the mere fact that some of them might not have the resources. To go to the hospitals to check if there is something exists. Okay. And like you said, multiple childbearing, and also could suppress. Let me put on a record, say once you are pregnant and all fibroids, they grow bigger.
The fibroids grow bigger?
Yes, because when you say you need estrogen and progesterone to keep the pregnancy. Yes, and once those hormones exist, not just they feed the fibroid mass and they begin to grow. But once na shrink it.
Now, I did back when I walk here about me who kakra and it said fibroids and said the amount of signs and symptoms be and it so big will be she knew a nipan a ben who a bed daddy 1 century ni be a nerdy. A manipani who say me wo fibroid DB. I'm an baby or horse.
It depends on okay, so fibroids vary in sizes.
Okay.
It be like your kind, it be so. And sometimes so all the types of the fibroids. I took care of a woman last week. She had all the type of fibroids. So your nodular fibroids and multiple fibroids. all the types of fibroids are available. If you are intramural or subserosal, all those things. So it depends on which type you have. And sometimes we have some particular symptoms. And some of the symptoms include, say, or painful sex.
But what can brofo? Yes, say, oh, fibroid, Nadia. I did back when the idea more who said, we know who can Asiana. We are until hon no sebi oba ne ba ni mu ana se sebi na yase ana hin no beti ya no
na yase ni ba ni.
Okay, enti doctor kan nyam kan o si wo beti e wo sebi wa yase ene wo ba no mu se fibroids no wo ho a
e mo so Johnson on say once fibroids no eba wa wodi ani mu a e additional pressure to a pelvic area no inti organs closer to uterus no your rectum e be temporarily e janine ye store no and no bladder inti
as I say na ma ye nyimo a ye baby no enyine na say wo Johnson tente because of the pressure sa na kwakọ okay
inti yes na Johnson twa no na bladder no intimi and store urine as much as it used to inti Johnson kakra be gu ma na say Johnny now called Johnson. Yes, okay. Into a Johnson tenter. And sometimes painful urination.
And yeah, UTI na when ya.
There be any UTI. So it's a fibroid abano. A mouth te yaw say oh called Johnson. And I even saw how moments no prolonged. There be like I say bleeding is between 3 to 7 days. Anything less, anything more, not just say or how. If you instead of 7 days, not bleed about 2 weeks, 14 days, 10 days, 11 days.
Now what you mean?
Yes.
Yes.
If you crab export it throughout the month.
So what fibroid now? What bones say we know? Bones are not fe moja kitting be baba.
And your friend intermenstrual bleeding.
Okay.
Yes. Into no to me it me see my who say it is likely say fibroids in your hole. Yes. Anna it's saying say the rectum is closer to the
or can rectum now or patch there sebi oto ho no. One will be a sebi e jana no e kwa ansana. E kan wa wakwa akoyi no e ho any rectum no
inti say fibroids no enyini ebro so it me block rectum no it ma constipation inti bo how it be chim sans with me jane nine we nya severe
say fibroid no ho a
yes
asa untumi nko ba bi so
yes untumi nko ba bi so
we am achene
now what about discharge?
Vaginal discharges. Yes, it's more chronic vaginal discharges.
Chronic?
Yes.
That means it's come to stay.
It comes to stay.
Wow.
Yes,
and on your UTI. When your symptoms, because look at painful urination is one of the telltale signs of UTI.
Of UTI, yes.
And we say sending all kind of vaginal discharge.
Yes.
International say self-medication.
Exactly. Yeah.
That's what comes to mind. What we say sabin so be fiwase, wuni ma de kro, ba no medro antibiotics bekun. Enti na hu hia so be hospital. Na doctor atire me say tell that nyani nyina na ye sabi white odepoa. Na mo maybe ana fibroid bi she ho. Doctor di embio. Na sa na obeko so
lower back pains.
Ya na ebi say ma omo ase omo afu yes omo nyem no.
Yes, ma and the signs are be hu ho, you know, be ma abdominal distension. Yes. Depending on the size.
Okay.
Ha nti e bi de hu omo abedwen so omo nyem. Yes. Yeah, nti etimi ma we fu no kese. Yes. And the sounds ma lower back pains which kase no it is a pains e wo ho. Nyina is because of the pressure fibroid and the to pelvic area no. Yes, nti we are lucky, fortunate that these are some of the signs with
pelvic area no patch usisi.
Yes, wayase
fa usisi echi nyina. Na doctor obi e wo fibroid da ofanyin se betumi asɛ no.
It depends on the location. Yes. They be a case of the fibroids. Yes. Maybe I can say uterine fibroids don't prevent pregnancy. In see a war and no quine. Yeah, very rare in rare cases. And ABC a war on quine. Now sometimes so not be ana a call unya submucosa or na be a dawudi nim. Na akrano so nyini together. Na difficult.
So ka say estrogen progesterone abofra here it helps aid pregnancy. Fibroid no so enso di nyini.
Yes, enso di nyini. Yes.
Enti na me busa say fibroid ni nyini baby ni so nyini is it likely say fibroid no be mi abofra na? Yes ankofo ka.
Oh, akra be nyini kama.
Akra be nyini kama.
But obenya if birth complications. No clients be for the larger part of the nyinse no not the hospital. because the pain was so severe.
And operating it is it's a no-no.
It depends. It depends on treatment of fibroids. No, it depends on what a person wants. Ubo hana opeba. Ubo also hana sebi ompeba. It's ni nyina the treatment called remain.
Doctor actually me find say obi awo miensa bi a wonya multiple fibroids.
Yeah.
Tete no bi a heavy bleeding, any those things. On person oba ubi ma, is that the option say be ya wo de ni nyina?
Yes. Until be total hysterectomy. It's when you are would ni nyina atu egu. Until no.
Because owo ma. E bi ko ani ni mpani wanyini wadu ni mpani mfie so. Ha no until obetumi ayi.
Okay. Because I have experience with people with fibroids, you know, I said like to me operation if we want more.
Yeah.
Then it has a tendency of also growing back.
Yes.
And what causes that?
Maybe Amika say it here. Then probably we arm ourselves with soldiers, maybe to prevent attacks on us. The soldier for around, police for around. Then we wake up and we've been thieves abe we are additional some soldiers number. You let them come because they have not been of any use to you. Their main aim was to prevent thievery or theft. It's not a fibroid here. We don't know how they come by. We don't. You name quite fast over. So there is no single way to prevent it. The fact say when you be crying, chest will be saying to me, in your eyes will be a divorce. The chances of divorcing is high. The fact say when you fibroid no once no means that the risk factors are still there that can predispose you to it.
When you go through the knife, let me use that word.
Yeah.
You chow now, you take the fibroid out. Don't they do everything possible to make sure say bakukra na say kitwe bi krampo enka wo honom and I say bi omure fi omuje bi wo honom.
Even if the only way I was apprehensive.
Yeah, because the doctor has the opportunity to to see near-kosua and as BBR. So how come? Because like I've had situations where it's like it's growing back.
Yeah.
We don't know what to do. How did this happen? Say be an and I say our lifestyle be as you said, we don't know what really makes that happen. When doctors go to operate now, what is really the procedure from there?
Okay, even with nowadays, there were a lot of very complex procedures to very simple procedures, depending on what you seek to achieve and depending on the size of the fibroids. Yes, there were very comprehensive procedures that you can see everything in the womb and take everything out. But it doesn't guarantee. Once the womb it means fibroids can regrow. If you don't want any then you take out the womb.
Wow.
Good.
Yes. Doctor, I did back to say young say first now you can fibroid and penning for a ma but they say young people, the youngest person me who say when you're fibroid 17. Okay. I didn't think I mean in your practice the youngest person when you're fibroid
I think I had one recently very recent. No, she was around 16 years.
Wow.
16.
Yes, she was around 16. And then now it was huge. The masses were huge. And the only thing we did was to do myomectomy. That's the removal of the fibroid masses.
Okay.
Yes. One other thing I can say, things like emergency contraceptives. Usually progesterone and its level, its derivatives. And they emergency contraceptives, you know.
Doctor, ya na person me kan twi na ni party ase. Me ma ne say bia wakotwa ho, ni obi akoda. Wa moa ho. Enti usuro nyinsen enti na wakofa pills ya ye fa ma nyinsen ma da ne fe no emergency contraceptives no. Doctor yen kan na me ka wo say ya na fibroid hu yesi ne dosu. De na wate a kire wadwene wo nsam musa bia na sa adwenkyire bia ye bebie phone lines no wobɛfrɛ na woni doctor edi nkomo wo ka doctor Bekle enti yesi bia wo ni awate ebi ehu papa obi ebi di ton wonuro enti ya na wo kan se bi ebi hu yesi ben na wate question ben apeso obi sa doctor numbers no go phone TV ne so frɛ na fe yeni nkomo doctor na he was answering the young
yeah yes pharmaceutically and medically no emergency contraceptive no Maximum is twice a year.
Emergencies don't always come.
Yes.
They are not daily, eh?
But nowadays, our women are always having emergencies. Some, maybe to me, for 3 times a week.
Oh, that's dangerous.
Yes, that's dangerous.
Yeah.
I have a friend who has a pharmacy, and I'll say they're moving on the pan
Emergency
contraceptives.
And that is killing the women,
Yes.
contributing to fibroids.
Supposedly, because they hormones, progesterone. And if you bombard your system with a lot of these things, inadvertently, now you are causing things to make shift in your womb.
That brings to mind, obago ha on way, or person preventive pregnancy, on pay emergency, but or one injectable.
Yeah.
Yes. 3 months there, and also can that also put the person at risk?
No, those ones are measured.
They are
Once
measured.
the oral
Okay.
combination, do family planning techniques in there. You better catch all. Say these are the things you are likely to face.
Okay.
Everything will be explained to you.
Okay.
Then you choose your options. Yes, there are a few instances that have weight gain here and there, but these in case Jaya, there are interventions. So those ones are okay. But these ones are just here for emergency sake.
Okay.
And you're not supposed to take more than twice in a whole year. Yes.
Yes, say emergency contraceptives, no. You find mienu pe afimuni nyina na ebi afa ne se mojaduro no mienu anopa no afa mienu anwume. Yes, we yes na wo de hu besi ba bi a fibroids ebetumi enya doctor say fibroids no very very young people na enya bi na question person buza doctor yes ben e na wo fibroids ho baako amate ne say obi so wo adura be ma fibroids ni nyina nane ama moja na no kwa na say
All right,
Okay.
but before we do that, let's go to Dome and talk to Joyce. Joyce, good morning.
Morning.
I'm a patrol. Doctor. How many dinkomo?
If I tell you because the Serbia, when your menses not 3 days beyond nature, and also Eric's out the boy in your father.
Me ba cho se yeti wase a wo su nya menses na na miensa na atwa. Okay, doctor be ya normal. I think you said something
Yes,
like that before.
normal.
Normal.
Nti no can mix now can no. If mo say if your menses I say about full 7 days. I'm 7 days and just mo jani bi akem with time other than fibroid.
Yes.
True.
Doctor say anya no correct.
Yeah.
Make to me the me one example. Me very normal be. Within 48 to 3 days. 48 hours to 3 days my entire life.
Okay. Yeah, that's
I've never gone 4 or 5 days that.
So
I
what-
thought I could 24 hours, 48 hours. But then it's heavy.
All right.
Yeah, I think you.
Enti ye heba for yon ebinum
Ebinum.
enti yesi se ubu nsa na miensa na se sebi moja no eba yi a na ehu hia se o
But what is another case where Mojane bang sopi you know so
Scanty menses.
What's it?
Scanty menses. They no na say drop it. Obi o ho na even fasting. O fasted. O menses say be ye. You are not eating properly. O menses say be ye. If you are now want severe anemia, there is no way the body will allow you to bleed that much. And your medical conditions.
Yam picky kolai Mansura from Kintampo.
Hello. Good
Yeah,
morning.
Good morning.
Pacho, my question me say on bleeding spotting no. Me obi a me ye injection for family planning.
Okay.
Na expire me bleed sometimes bakra ebi over e spot do I have to fear say a fibroid and say normal?
Thank you so much, Mansura. Or say so you injectable no. Sometimes or sporty, sometimes
Yeah, it's
is it
normal.
a characteristic of the injectable?
Yeah, it's normal. You just have to go back to your family planning unit and address your mom.
Mansura, doctor says sign call baby a wo pane no ka kire won ni a wo hunu na ya me emfa de enhye hu sa ya na ye fere ade nti kwa no aka say we ni na me hunu na doctor so me treat mu na mum mo akoma nto yem because e normal.
Yeah, I was going to say, what if we are cohonum and there's nothing being done about it? Then what she should do?
If it depends. Some of the family planning techniques, no, you better explain natural. So these are like the likely things you are. Yeah, but Oceana say it's affecting your quality of life.
Stop it.
Then yes, then you seek a second opinion. Yes.
All right.
It's all about quality of life. Which one is
Okay.
affecting you.
Vida is on the line. Vida, very good morning. I want to say, Vida. Hello, Vida. I think we lost her on that one.
Yeah, so Kwesi asked a question. I want you to clarify that. We are family planning be I want to timu abeboa ma bebre because ebi a wontem be a wenya miensa and 9 you are still within your 30s.
Yeah.
Umbe so obewu bio. Nti family planning na be you give this enko for issues bebre. Nti senior how can who ka say we family planning do be na say ya how yi
Yes, one free payment.
Ubeko na ya boa. Minimum bi a no share your friend is an IUD no. Wa share no be 6 7 years. Afei or wha won say IUD dey nka period ni sisi ano. Or wha otumi bleeding hu bi. A woni baby efi enya ni period o. Wa hu na no ubeka say onko yi immediately because o ka say the doctor say onko yi ni immediately. Obi was high issue now would you advise the same?
Oh yes. And let me add, say, a very big comorbidity. Comorbidity.
Okay.
It be crying na yare no hoda. It be an or family planning technique na for faba. It be an or but na and numerous pempensoa ebe da ni hwedi. Yes, inti unhua the best thing is to come back. You'll be re-examined. Say if we technique now use na you share na yaka ho asem. It means na yare a afi na aba a emfa or technique no. Baby, I can say, Obi or na I didn't know who to be a baby out the best.
Say because family planning na say family planning who but abefem. But now can you see no. What's the fibroid in naneda? It's never possible.
Fibroids seba fufra number one, they could grow and become larger or they could be the same size throughout. If you say eh yini kra ne size no or the
Doctor we there yemfa gift na fe yemra. Gift good morning. Gifty from Dansoman, good morning.
Hello, morning.
Hi, Gifty, what is saying?
All
right, Gifty, I know pay question ben a woman doctor.
Okay, me paucho. Me so me then say, I am my medicine no, ba, like for 6 months ni ba, and I make call hospital, and like doctor me bisa me say like. May you say good and I'm catching say baby.
Me ba try no any question busa o.
Nti time and no catching me say and the obetwe me pass and me na me wu tem enye sami ntimi. By the case me to me but me there find me.
Me ba try why your fibroid operation da na?
Okay, me got a scan. But me name says a fibroid no me but me try me scan.
Man catch you like
Okay, I'll catch you and say, me bombardiana, me saying them.
Okay.
And yes, like me to me.
Wow.
All right, Musa doctor. And that doctor, the question for found 1 year fibroid.
To say men's name, Bano, may they have found me.
Me ba what is saying?
Okay, me was 27, me 28 November.
Okay, yeah, that's CP. Doctor, yeah,
okay.
No. All right, that's yeah, no.
I was saying the men's for 6 months.
6 months.
That's a typical, not just a bar before and that's a typical case of amenorrhea. Women stop it for more than 3 months. Not just a medical event amenorrhea. And a lot of conditions a bit me amenorrhea. So also for more than 2 years, it could even be menopause.
What can I say now? Women are getting menopause very early.
Yeah.
And she's 20, she's 7. So, doctor, and no cry say ukoye fibroid operation. I was so insensitive. I didn't know. And no cry because the brain say omo doctors cast asem no.
Yeah, me can be that.
Ukwa can be that. I didn't know kai.
Okay, so fibroids exist here. That's when your clients, you know, sometimes you per at the point of delivery, you know, it me fibroid masses needed. And we work about CS. Say after CS or during CS, you can still take some.
Into moon ni fibroid no. Nemo uka sen kakonyin sembra. Na ye baby na. Nanka de afa ho yi bi. Na woni a ye yi omo de na. Unso bi o ha ye yi ni de o. But ye still onyin sen.
Ye yi ni de sen.
Ye yi fibroid no. But ye say onyin sen tentem.
And yes, I say what asase. I go try ho na we incident also.
All right.
If we ever baso. We call back no na nyame fifi also.
Okay.
Okay. Usually no wa wo mo twa ye nim kwan fast but we suspect say because the womb is fallow. Things begin to grow.
All right.
Yes.
Now, for this lady who called from Dansuma, no, I say 6 months, the period.
Yeah.
But doctor now advises say uncle, then uncle in them. Is it possible to go to me out? Is there a possibility?
Oh yes, there's a possibility. Even vigorous exercise as a woman, your menses might not come. Until you very active sports near they have.
And those who enter the force.
Yes.
And mobile hurrah soldier mo. No complaining say
exercise vigorous ones. Once you are doing a vigorous exercise, no, hormone different testosterone. It's predominantly in men. Kakra or memu. But because nyama mema no, then you have to double up with yours. Until man testosterone levels no ekostro. So na be able to tolerate exercise no. Until you able to suppress menses no kakra. But no enche so ntimi wo. Obetimi awo when the hormones are in a balance. Ebiana doctor ni hu ohwe no we hu a particular condition. With time no, one of the complications of the condition is infertility, temporary infertility.
Okay.
Then Cecilia, you haven't gotten there no. But you're higher in term. That is if you want to give birth.
That's a lot of pressure.
Doctor, yes, no one way.
Yeah.
Yes, no, yeah, brain into yes, in Kabaku me be nothing.
Okay, and like we have said, fibroids are not cancerous. And yet cancerous. And all fibroids are with me insane. There is no way all fibroids are only insane. And like Alex said, we are everything to me about. We work as an amakoye myomectomy and asamba yet it is normal. And yet before we are need to
Doctor, or baby sure what age would you advise Enka? Ideal so baby uncle baby abewu.
Once we do reproductive age.
Then reproductive age starts from 10. 10, 11, 12.
Support systems now with me
at age 10.
The law supports it because I think below 16
you can't.
You can't engage in sexual activity.
Above 18.
Yes, once
will be ideal.
From 18.
Yes, it's ideal.
Okay.
Doctor, if you ben Audubema or bar or sharing about uterine fibroids, would you say it's not in the system?
Okay, the mechanism. Like we have said, no, uterine fibroids might not give you signs or symptoms. Until try manama signs and symptoms, a baby out. Until I advise women, Oboha no who scan machine card, or nim on your scan card, and so they be OD pizza and shawarma. Scans don't cost up to 100 cedis, 120, 80, 70. You know, so once a while, we do penny fees so there. You go beneath the scan.
Okay. Yeah, but now so, no moment, 10 no. Ultimate clinic more him.
Community 18 Spintex.
Okay.
Yes.
Oh,
okay. Okay, so be person no kasa phone number to Jana.
0541 727 818. 0541 727 818.
All right.